Want to score over 850 in your Hesi Fundamentals exam? Then let's get started. Question 1. A nurse is assessing a patient's respiratory status. Which assessment finding indicates a potential respiratory problem? Oxygen saturation of 98%, respiratory rate of 12 breaths per minute, diminished breath sounds on auscultation, skin warm and dry. Pause the video and select your answer. If you chose option C, you are correct. Diminished breath sounds on auscultation. Diminished breath sounds can indicate respiratory problems such as pneumonia or pneumothorax. Question 2. During a physical assessment, the nurse notes that the patient has increased tactile fremitus. What should the nurse suspect? Pleural effusion, pneumonia, asthma, COPD. Pause the video and select your answer. If you chose option B, you are correct. Pneumonia. Increased tactile fremitus indicates increased density or consolidation in the lungs, commonly seen in pneumonia. Question 3. While assessing a patient's respiratory status, the nurse observes paradoxical chest movement. What could be the cause of this finding? Pneumothorax, atelectasis, flail chest, pleural effusion. Pause the video and select your answer. If you chose option C, you are correct. Flail chest. Paradoxical chest movements occur when a segment of the chest wall moves inward during inspiration and outward during expiration, typically seen in flail chest. Question 4. A nurse is assessing a patient's cardiovascular status. Which assessment finding indicates a potential cardiac problem? Blood pressure of 120 over 80, radial pulse rate of 72 beats per minute, jugular vein distension, capillary refill time of less than 3 seconds. Pause the video and select your answer. If you chose option C, you are correct. Jugular vein distension. Jugular vein distension can indicate fluid overload or right-sided heart failure. Question 5. While assessing a patient's cardiovascular status, the nurse detects a new onset murmur. What condition should a nurse suspect? Aortic stenosis, mitral regurgitation, ventricular septal defect, PDA. Pause the video and select your answer. If you chose option B, you are correct. Mitral regurgitation. Mitral regurgitation often presents with a new onset murmur heard at the apex. Question 6. During an abdominal assessment, the nurse palpates a mass in the right upper quadrant. What should the nurse suspect? Enlarged liver, enlarged spleen, kidney stone, ascites. Pause the video and select your answer. If you chose option A, you are correct. Enlarged liver. A mass in the right upper quadrant suggests hepatomegaly or an enlarged liver. Question 7. While assessing a patient's neurologic status, the nurse observes unequal pupils. What condition should the nurse suspect? Stroke, brain tumor, Horner syndrome, migraine headache. Pause the video and select your answer. If you chose option C, you are correct. Horner syndrome. Horner syndrome can present with unequal pupils due to sympathetic nerve dysfunction. Question 8. While assessing a patient's musculoskeletal status, the nurse notes limited range of motion and crepitus in the knee joint. What condition should the nurse suspect? Osteoarthritis, rheumatoid arthritis, gout, bursitis. Pause the video and select your answer. If you chose option A, you are correct. Osteoarthritis. Osteoarthritis often presents with limited range of motion, joint stiffness, and crepitus. Question 9. While assessing a patient's skin, the nurse notes redness, warmth, and swelling over the lower leg. What condition should the nurse suspect? Cellulitis, DVT, varicose veins, contact dermatitis. Pause the video and select your answer. If you chose option A, cellulitis, you are correct. Cellulitis presents with localized redness, warmth, swelling, and tenderness, often with systemic symptoms such as fever. Question 10. While assessing a patient's gastrointestinal status, the nurse auscultates hyperactive bowel sounds. What condition should a nurse suspect? Constipation, gastroenteritis, bowel obstructing, diverticulitis. Pause the video and select your answer. If you chose option B, you are correct. Gastroenteritis. Hyperactive bowel sounds are common in gastroenteritis due to increased peristalsis. Click that subscribe button and join us next Friday.